Hello, and welcome back. Have you ever been diagnosed with or feared that you might be diagnosed with an ectopic pregnancy? Or are you someone that's more interested in looking up information on the topic and got the bright idea of researching it on prehealth.org? Well, let prehealth provide you with all the relevant information you need for your next doctor's visit, starting with the question, what is an ectopic pregnancy? So, an ectopic pregnancy is characterized by the implantation and subsequent development of the embryo outside of the uterus. This can occur, for instance, in the fallopian tube, or in extreme cases, even the ovaries. While the incidence of ectopic pregnancies may vary between countries, up to about 2% of females in the United States are affected by it. It is usually very stressful for a woman when she is at a high risk of or may fear that her pregnancy is ectopic. Ectopic pregnancies greatly endanger the prospective parent as there is a large risk of organ rupture and hemorrhage, which can be fatal. But what you might not know is that early testing can actually help reduce unnecessary fatalities and complications. So, early on, the standard testing method is the ultrasound analysis. During the first ultrasound assessment, clinicians investigate whether an embryo is indeed present and whether it is located inside the uterus or at an unfavorable location elsewhere. It can be that sometimes the location of the pregnancy cannot be identified via ultrasound only. In this case, a commonly preferred test to verify the assumption of an ectopic pregnancy is the HCG measurement. Beta-HCG is a hormone that is detectable in blood in early pregnancy. Only a single measurement of the concentration of beta-HCG is already used in the clinic to confirm a pregnancy. However, serial measurements of this hormone can additionally give information about the viability of the embryo. During a healthy pregnancy, the concentration of beta-HCG doubles approximately every 48 hours. But when a rise in beta-HCG concentration over 48 hours does not reach 50% or a plateau of the beta-HCG concentration is observed within the time frame, a non-viable pregnancy is assumed. This increases the likelihood of an ectopic pregnancy. A further option for the doctor to identify an ectopic pregnancy is to perform a laparoscopy. However, this surgical procedure is only performed when there is a large suspicion of an ectopic pregnancy. A major advantage of this surgical confirmation is that possibility for the doctors to immediately intervene when an ectopic pregnancy is detected. Well, that brings us to the end of this video. We hope you learned something. For more information on the matter, please visit prehealth.org. See you next time.